Welcome to Optic Surgeon, the ophthalmology podcast, where we look beyond 2020. I'm your host, and my goal here is really to help simplify and deepen your understanding of ophthalmology, one topic at a time. Whether you're maybe prepping for exams or just sharpening those clinical skills, this deep dive aims to break down key concepts so you can really master eye care. Today, we're diving into something pretty specific and, honestly, quite concerning: sudden vision loss. But not just any vision loss, it happens in just one eye, and crucially, without any pain. Think of this as your personal exploration, a way to understand what might be happening when vision takes this kind of unexpected dip. Our mission today is to connect these characteristics, sudden, one eye, no pain, to the possible underlying causes.
Exactly. And, the way vision loss presents itself sudden or slow, one eye or both, pain or no pain, it gives us vital clues right from the start. So focusing on this specific combination today should help us unpack the most likely culprits.
Okay, let's jump right into it then. Sudden, painless vision loss, just one eye. What are the first things that come to your mind?
Well, one of the most critical conditions, something we think about immediately, is a central retinal artery occlusion. You'll often hear it called CRAO.
CRAO. Yeah, I've heard that described as a stroke of the eye. That sounds, well, serious?
It absolutely is. That comparison, the stroke of the eye, it really hits home how urgent this is. Just like a brain stroke, it's a sudden block. But here, it's the main artery feeding the retina blood. And what's really quite characteristic when we examine the eye is this widespread whitening across the retina.
Whitening, like the whole retina looks pale.
Pretty much, yeah. Except for one really striking feature. There's usually a very distinct, vivid red spot right at the macula. And remember, the macula is that central spot, the part responsible for all our sharp, detailed vision.
Ah, the cherry red spot. That sounds like a really key diagnostic sign. Why does that happen exactly?
It's all about the blood supply, really. The main central retinal artery, it supplies most of the retina, but the macula, it actually has a slightly different sort of secondary blood source deeper down. So when that main artery gets blocked, the surrounding retina, it gets starved of oxygen, it swells up, looks pale. But the macula, because of its separate supply, keeps its normal red color. And that creates this really stark contrast, the cherry red spot in this pale background.
Okay, that's a really helpful visual. And it sounds like CRAO isn't just, an isolated eye problem.
Exactly right. A CRAO can often be a big red flag. It signals potential underlying systemic issues. We often think about problems with the carotid arteries, the main ones in your neck, feeding the brain and eyes. Also, conditions like high blood pressure, diabetes, they increase the risk too. And importantly, in people over, say, 55, we also have to seriously consider something called giant cell arteritis, or GCA.
GCA. Okay. So if someone experiences this kind of sudden painless loss in one eye, what's the immediate action? What should they do?
It needs immediate, urgent attention. You have to think of it as an ocular emergency. Time is absolutely critical if there's any chance of restoring blood flow to that retina. The standard recommendation is straight to an emergency department, no delay, and ideally one that's set up as a stroke center.
A stroke center, right?
Yeah.
That makes perfect sense with the stroke of the eye comparison.
Yeah.
What about that link you mentioned, giant cell arteritis in older patients?
Yeah, so in patients, let's say 55 and older, presenting with this sudden painless vision loss, our suspicion for GCA goes way up. GCA is an inflammatory condition, it affects blood vessels, and crucially, it can cause permanent damage to the optic nerve, the retina, if it's not treated really fast. So in these cases, we need blood tests urgently. Things like ESR, CRP, and a platelet count, they're vital.
Got it. So CRAO is definitely a major concern. What else is on the list? What else could cause this specific type of vision loss?
Well, related to CRAO actually is something called a branch retinal artery occlusion. BRAO for short.
BRAO. Okay, so not the main central artery, but what of its smaller branches?
Precisely. The mechanism is basically the same, a blockage, usually a tiny quad or embolus. But because it's a smaller vessel that's blocked, the impact on vision might be less severe. Or maybe it only affects a certain section of your visual field, not the whole eye's vision.
Okay, so the pattern or severity of the vision loss might give a clue there. Makes sense. What about structural issues? Problems with the eye itself?
Yes, definitely. A retinal detachment, often just called RD, that's another really important possibility.
Retinal detachment. That's when the retina lifts away from the back surface of the eye.
That's exactly it. And if that detachment involves the macula, that central vision area we keep mentioning, it can absolutely cause sudden and often quite significant vision loss.
Right. What might someone actually experience if they have a retinal detachment starting?
Well, common symptoms people report are a sudden increase in floaters, those little specks or like cobwebs that drift around. Many people also see flashing lights, like camera flashes off to the side. And a really classic description is feeling like a curtain or maybe a shadow is moving across their vision.
A curtain falling.
Yeah.
Yeah, that's a very vivid description. What would an eye doctor actually see during the exam?
We might see the retina looking lifted. Sometimes it looks kind of wavy or even folded. And often we can find the actual tear or break in the retina that allowed fluid to get underneath and cause the detachment in the first place.
Okay, but what if the view inside is blocked? You mentioned something about blood potentially getting in the way earlier.
Yeah, good point. If there's blood inside the vitreous, that's the clear gel filling the main cavity of the eye, it can completely block our view of the retina. We call that a vitreous hemorrhage, or VH. In those situations, we often turn to a B-scan ultrasound. It uses sound waves, basically, to build up a picture of the back of the eye. It lets us see the retina even if we can't look directly at it. And interestingly, something called a posterior vitreous detachment, or PVD, that's where the vitreous gel just naturally pulls away from the retina as we age sometimes. That process can actually cause a retinal tear, and that tear can then lead to a full retinal detachment.
So a PVD, which is pretty common, can sometimes be the first step towards a detachment. Okay, let's talk more about that vitreous hemorrhage itself then.
Yeah.
How does blood in the vitreous cause painless vision loss?
Well, think of the vitreous normally as being perfectly clear, like clear jelly. If blood gets into that space, it just clouds everything up. Depending on how much blood there is, it could cause just blurry vision, or maybe lots of new floaters, sometimes described as webs or strings. And if it's a really dense bleed, it can cause a very significant drop in vision. It's painless because there aren't really any pain nerves within the vitreous gel itself.
I see. And where does this blood usually come from? What causes the bleeding?
There are several common causes for a vitreous hemorrhage. A really major one is complications from diabetic retinopathy, where diabetes damages the small blood vessels in the retina, making them leaky or prone to breaking. As we just discussed, a retinal tear or detachment can also bleed into the vitreous. Another possibility is a blockage in one of the retinal veins, not arteries this time. Less common things might be, say, a ruptured tiny aneurysm inside the eye, or maybe eye trauma. Oh, and also the growth of abnormal new blood vessels, we call that neovascularization. These new vessels are often very fragile and they bleed easily.
Wow. Okay, so quite a few different paths can lead to blood clouding up the vitreous.
That's right. And in cases where the vitreous hemorrhage is really dense, we might see something called a relative afferent pupillary defect, an RAPD.
RAPD, what does that finding tell you?
An RAPD basically points to an asymmetry in how well the optic nerves are working. So when we shine a light in the unaffected eye, both pupils constrict normally, as they should. But then when we quickly swing the light over to the affected eye instead of staying constricted, the pupils might actually widen slightly, paradoxically. It suggests that the affected eye isn't sending as strong a signal about the light back to the brain, usually means significant retinal damage or optic nerve dysfunction.
Interesting. So even the way the pupils react gives important clues.
Yeah.
Okay, let's shift focus now to the optic nerve itself. Can problems there cause this sudden, painless, one-eyed vision loss?
Absolutely. Ischemic optic neuropathy is a really critical one to consider here. As the name suggests, ischemic, it means there's not enough blood flow getting to the optic nerve head.
It's ischemic. So again, it comes down to blood supply problems.
Precisely. The optic nerve is, well, it's the main cable carrying all the visual information from the eye back to the brain. So any disruption is serious. We usually think about two main types or categories of ischemic optic neuropathy. There's non-arteritic ischemic optic neuropathy, NA-ION, and then there's arteritic ischemic optic neuropathy.
NA-ION versus arteritic. What's the key difference there?
Well, the arteritic form is the one that's often linked to that systemic inflammatory condition we talked about earlier, giant cell arteritis, GCA. NAION, on the other hand, usually happens without that widespread blood vessel inflammation. And interestingly, while optic neuritis inflammation of the optic nerve usually presents with pain,
Right. We should probably touch on optic neuritis too.
we definitely should. But NAION is typically painless, although maybe about 10% of people might report some, vague discomfort. And the vision loss in NAION, it might actually worsen a bit over a few days or even weeks.
Okay. And what does the optic nerve actually look like when you examine someone with NA-ION?
Initially, the optic disc, that's the part of the optic nerve we can see at the back of the eye, it often looks swollen, maybe reddish, what we call hyperemic. But then over time, it usually becomes quite pale.
And the arteritic form, the one connected to GCA.
In arteritic ischemic optic neuropathy, The optic disc swelling tends to look very different. It's often described as having this diffuse, sort of chalky white pallor, very pale right from the start.
Are there typical age groups associated with these two types?
Yes, generally. NAION is more common in people maybe in their 40s up to their 60s. The arteritic type, because it's linked with GCA, is much more common in those aged 55 and older.
So there it is again. An older patient comes in with sudden, painless vision loss in one eye.
Yeah, the suspicion for GCA and therefore arteritic ischemic optic neuropathy has to be very high. And that means getting those urgent blood tests we mentioned, the ESR, CRP, and platelets. It's critical not to miss GCA.
Okay, that makes sense. Now, let's circle back quickly to optic neuritis. You said it's usually painful, but can sometimes fit this picture of sudden, one-eyed, painless loss.
Yes, exactly. Optic neuritis, as we said, it's inflammation of the optic nerve. Now, sometimes this inflammation happens behind the part of the optic nerve we can actually see inside the eye, behind the optic disc. We call this retrobulbar optic neuritis. And the key thing here is that the optic disc itself can look completely normal, especially in the early stages.
So the nerve head looks fine initially, even though there's a problem further back.
Right. Now, most people with optic neuritis do get pain, especially when they move their eyes. That's a very classic symptom. But occasionally, it can present without any pain at all. However, even in those painless cases, a really common, almost hallmark finding is a significant drop in color vision. Colors just look washed out, faded, much less vibrant.
Ah, okay. So a change in color perception, even without pain, could point towards optic neuritis.
Yes, often quite dramatically different color perception. And furthermore, optic neuritis, particularly in younger adults, can sometimes be the very first sign of multiple sclerosis, MS.
Right, I know there's a strong connection there.
Yeah, because MS itself involves inflammation and damage to the myelin sheath around nerve fibers, including the optic nerve. So if someone presents with optic neuritis, especially if they're younger, doctors will often consider ordering an MRI scan of the brain and the eye sockets, looking for those characteristic lesions that suggest MS.
Wow. So it really drives home the point that even symptoms that seem straightforward, sudden vision loss, one eye, no pain, can actually point to a really diverse range of underlying causes,
Yeah.
some needing incredibly urgent attention.
Absolutely. It just highlights the amazing complexity of our visual system and how delicate it is, and why a thorough evaluation is so important whenever vision changes suddenly.
Well, this has been a really, really insightful deep dive. We've unpacked quite a few key possibilities for sudden, painless unilateral vision loss from, blood flow emergencies like CRIO to structural things like retinal detachment and nerve issues like ischemic optic neuropathy and even optic neuritis sometimes. It definitely underscores how interconnected it all is.
It really does, and hopefully walking through these possibilities provides a clearer framework for, understanding what might be going on if you encounter or hear about these symptoms.
Definitely. So thinking ahead, what other areas of ophthalmology or maybe specific vision changes are sparking your curiosity? We really encourage you, the listener, to keep exploring these topics and, of course, always discuss any vision concerns you might have with your own eye care professional. For now, though, thank you for joining us on this deep dive into sudden vision loss. What fascinating aspect of the eye or vision should we perhaps unpack next time?